Hello, my name's Lynn Williams. I'm the Associate Director for Quality Improvement, and this is my second blog update on the Trustwide Learning Forum. Trustwide Learning Forum is there to promote collaborative, multidisciplinary, cross-organisational working and ownership for disseminating learning to improve clinical practice and patient safety. We do lots of conversations around the kinds of tools and strategies that can be used for learning lessons, and how we can then move that and apply that into practice using systems thinking and continuous quality improvement. We also identify opportunities for rapid learning to share and grow success. And this time, the Learning Forum, we had over 30 people attend on the call from across the trust. And from my first blog, we had 6 or 7 people attend, which was great, who came along to see what the Learning Forum was like. And we'd like to be able to offer that out to everybody again. If you're interested in attending the Learning Forum, the quality improvement email address is below on the screen. People were really interested in, obviously, what's been going on within the trust. So we did a small masterclass, which I shared some learning around appreciative inquiry and how appreciative inquiry can really help as an organisational approach to look at what we want more of rather than what the problem is. And it actually supports a patient safety culture and also supports staff wellbeing, because it balances out, what the problem is, much more towards what we want more of. And that's what we want to do, is grow more of what's working well across the trust and scale and spread it. So that's really important. And we started with thinking about one thing that's gone well at work this week, because we don't always talk about what's gone well. We talk about what the issue is. And we had lots of feedback around welcoming new staff in roles, making new connections across the trust, enjoying a recent ICS quality improvement and organisational development event, positive meeting planning. So some really great feedback on some good stuff that's going on across the trust. And we noticed how much, in talking in that way, the energy changed, even in the virtual room. And this is really important for wellbeing, but it's also important for learning. And then we sort of thought about how we take those stories that we're hearing about the good practice from the forum back to our teams. And I think that's more work for us to do. But actually going back and sharing stories is good enough in itself, that if you can go back and talk to your team, or you can talk to a colleague, or find that opportunity for a learning space in a conversation, then that's the way to share learning, and then to actually use it to take action to change practice. We noticed with appreciative inquiry that actually thriving services, ones that are functioning well, are generally those that are actually high performing. And you will see this in a lot of organisations that are rated good and outstanding. So it's really important to think about that kind of mindset. That improvement and appreciative mindset is really important. It doesn't ignore the challenges and the issues. We still have to talk about some of the difficult things that happen, but it enables us to look at where services and organisations have actually found solutions and how we can bring those into the organisation and share that. We had a number of great presentations which helped in regards to understanding where we were in terms of implementation and learning around patient safety, and also suicide prevention and awareness. The presentation on patient safety was delivered by Kieran, our patient safety lead and expert, and he talks about PSIRF, the Patient Safety Incident Response Framework, and the 18-month timeline it's going to take to implement this, both across the system and within the organisation. It really is about learning and developing effective systems and processes for responding to patient safety incidents for the purpose of learning and improving patient safety. So improvement is very much a feature of this, and learning is a stronger feature than was previously within the SUI framework. So there's a joined up system approach to that, and it's something that we will update you on further as we learn more about how we're going to be implementing that. And then we had Rachel Lees, who did a fabulous presentation and really raised awareness around suicide prevention. And we didn't have quite enough time to complete that during the session, so we are now going to run that again in November. Lots of feedback from colleagues. They said at the end of the session, time for presentations, they thought were awesome. It was a shame that there wasn't enough allocated time. We ran out of time, so we need more time. We need to be a bit more structured and try probably to not cram so much in as we're learning. More on sharing the key direction of travel for patient safety. That was important to people. So what, and more explorative discussions rather than rushing through an interesting agenda. So trying to understand what that means about taking that back into the workplace to change practice. The power of sharing positive experiences was really important. Learning is crucial, and how to take the topics back to team bases to disseminate learning. And as I said, you know, using story, we can do that. That's in our gift, and we can do that. Next time, we hope to have more from Rachel Lees on suicide prevention and awareness to finish off the part of the session she didn't complete, because people were really engaged with that. Learning from deaths within forensic services. And we've got a number of people who attended the mental health nursing research conference in Oxford through the virtual platform, and they'll be feeding back their experience and what they learned in terms of research. And we'll have some time to network and to share learning and think about how we then disseminate learning. If you want to attend to see what it's like, please contact the quality improvement at nots.nhs.uk email address on the link below. And if you'd like to attend, the next session is on the 17th of November. So that's the end of my second blog. I look forward to hopefully seeing you in November, and take care, look after each other.